Hello, today we begin our lecture on the larynx. So the larynx is going to be in the neck. And if you remember, growing up, you always talked about an Adam's apple. And this usually occurs or is more prominent in males, right? This feature has a biblical background, as believed to, if you remember the story of Adam and Eve, they believe to say that Adam actually partook of the forbidden fruit. Then he had a piece of it or a chunk of it that actually got stuck in his neck. Hence the name Adam's apple to the front of the thyroid cartilage that is actually prominent, right? But however, that is just a fictitious story, and this larynx doesn't have anything to do with the meals that you partake, right? It's actually going to be a cartilaginous structure that is going to be composed of 6 different cartilages that we'll describe in just a moment, right? So this is the position of the larynx in the neck as it relates to the surface, right? From here, we can appreciate the thyroid cartilage, that is your thyrohyoid membrane, that is going to attach your thyroid cartilage to the hyoid bone. We're going to talk much more about that one. And that's your thyroid notch. That's a median cricothyroid ligament. Then you'd expect this to be the arc of the cricoid cartilage. This structure going down would then become the thoracic part of the trachea, right? So the functions of the larynx will include phonation, respiration, protection, as well as deglutition, right? And in terms of location, we can appreciate that the larynx is situated in the anterior midline in the upper part of the neck in front of the laryngopharynx. So you're also going to find a pharynx that is going to be divided into a nasopharynx, an oropharynx, then a laryngopharynx. There's a separate video for that. So in front of the laryngopharynx, you expect to find your larynx, right? This larynx extends from the root of the tongue to the trachea and lies in front of the third, the fourth, the fifth, and the sixth cervical vertebra, right? However, in females as well as younger children, it is slightly elevated. And the measurements for the larynx actually differ between males and females in terms of the dimensions, be it vertical, transverse, or the anteroposterior diameter. And even though you're going to find that when we eventually talk about the thyroid cartilage, it's almost going to be acute in males, giving rise to a 90-degree angle, whilst in females, it's almost obtuse, giving rise to a 120-degree angle. Hence, it's not as apparent as that for the male on the surface, right? So that is after puberty, but before puberty, the size of the larynx will be the same in both males and females, right? So this is a rather good depiction of what we're going to talk about. This bone here was a bone that we found in the neck that was going to be your hyoid bone, right? Then these cartilages are making up the framework of the larynx. From this view, we can appreciate the presence of the thyroid cartilage. We can appreciate this being the cricothyroid joint. Then we can also appreciate the cricoid cartilage. So there's going to be a joint that is going to exist between the thyroid cartilage and the cricoid cartilage. So that is going to be your cricothyroid joint, right? Then there's this very prominent membrane that is going to be your thyrohyoid membrane. The thyrohyoid membrane will attach the thyroid cartilage to the hyoid bone, right? Then if you look at the thyrohyoid membrane, it's going to have an aperture within it, and that is going to be for the internal branch. So that is going to be for the internal branch of the superior laryngeal nerve and its associated artery, which will be the superior laryngeal artery, right? We can appreciate the superior thyroid tubercle. There's an oblique line to which muscles actually attach. Then it has an inferior horn, right? Hence, it also has a superior horn. When in doubt, if you're going to come across a superior horn, just expect to find an inferior horn somewhere. Then there's a median cricothyroid ligament. Crico attaches the cricoid cartilage to the thyroid cartilage, right? So if you look at the skeleton, the skeletal framework of the larynx consists of a series of cartilages that are actually 6 in number. So you can either talk of these cartilages or divide them as getting 3 that are paired, then you have 3 that are unpaired. So the unpaired cartilages for the larynx will be the thyroid, the cricoid, and the epiglottis. Those 3 that are unpaired, this is the epiglottis. I've already shown you the thyroid, which from here we can appreciate from its posterior view. This is the cricoid. Those 3 that are unpaired are large. Then you're going to have paired cartilages that are actually small. So you're going to find the arytenoid cartilages, which are these ones. Right? You also expect to find the corniculate, which are these ones. Then the cuneiform cartilages. So they will actually be named relative to their shapes. Right? But the principal cartilages of the larynx are the cricoid, the thyroid, and the 2 arytenoids. Right? Those are the principal cartilages. Right? So to describe them, we'll start with the thyroid cartilage. Right? The thyroid cartilage, it's more apparent from this view, and we can appreciate that this is your thyroid cartilage. Right? Obvious anatomic landmarks that you can find on the cartilage include this oblique line. Right? So this thyroid cartilage is the most prominent, and it acts as a shield for the whole larynx. Right? And remember, I say that it was also going to give you an acute angle in males, almost 90 degrees, but in females, it was going to be about 120 degrees. Right? That is going to be your thyroid angle. Right? Then this thyroid angle, that is your Adam's apple. Earlier on when I started, I gave reference to the story of Adam and Eve. Right? So if you look at the posterior surface of the thyroid cartilage in the median plane, there are going to be structures that are going to be attached there. Right? So the structures that you find there will include the thyroepiglottic ligament, a pair of vestibular ligaments, and a pair of vocal ligaments, something that I'm going to give emphasis on when we eventually talk about voice production and phonation. Right? So that's a lateral view of your thyroid cartilage. This is a posterior lateral view. Right? So on that posterior surface, that's where you expect those 3 structures. Right? Then coming back to our main diagram for the thyroid, if you look at the thyroid, it consists of 2 quadrilateral lamina which meet in front to give you that thyroid angle. Right? So it does have 2 quadrilateral lamina. Right? And on the posterior border of each lamina, there are going to be horns or cornu. So you have a superior horn and an inferior horn. Those horns provide insertion for 3 muscles of the pharynx. Those muscles of the pharynx, if you go and listen to the video on the pharynx, they are actually extrinsic muscles of the pharynx. So there is the palatopharyngeus, there is the salpingopharyngeus, then there is the stylopharyngeus. Right? Then the outer surface of each lamina presents an oblique line, which we can appreciate from here. So that's your oblique line. Right. This oblique line also provides attachment for muscles. Those muscles are the thyroid, the sternothyroid, and part of the inferior constrictor muscle, which we described with the pharynx. That part will be the thyropharyngeus part. That is what you expect to find attached on this thyroid cartilage. Right. And if you remember, these cartilages from your general histology, how you talked about elastic cartilage, fibrocartilage, and hyaline cartilage, how elastic cartilage and hyaline cartilage were going to be typified by type 2 collagen mainly, whereas fibrocartilage was going to have a predominant type 1 collagen, and it was only going to grow through interstitial growth, unlike the other forms of cartilage. Right. So if you look at the cartilages of the larynx, 3 of them are elastic, 3 of them are hyaline. An easy way to remember, you can say E for E. So the epiglottis is elastic cartilage. The thyroid, the cricoid, and the arytenoid, those are the principal cartilages that I mentioned, the 3 of them, they are hyaline cartilage. Then the corniculate and the cuneiform would then become elastic cartilages, right? That is the vestibular ligament that I talked about. It has been cut, right? Notice how it's going to attach in that region there, also on the thyroid cartilage, right? So that's the thyroid cartilage. The cricoid cartilage is a signet ring-shaped cartilage, which has a very narrow anterior arc and a broader posterior lamina. And this cricoid cartilage is situated at the level of C6 cervical vertebra, right? Where the larynx ends, then you'd expect to find the trachea. Where the pharynx ends, then you'd expect to find the esophagus. So this cartilage, the cricoid, it's signet ring shaped, and it completely encircles the lumen of the larynx. It is the only part of the larynx which completely encircles the lumen of the larynx, hence referred to as the foundation stone of the larynx. Then the epiglottis, E for E, that's elastic cartilage. It is shaped like a leaf, as you can appreciate from this diagram, right? And its upper border or its upper margin is actually free. And this forms the upper margin or the upper extremity of the laryngeal inlet. And its lower end forms a stalk for the leaf, right? And this lower end or that stalk, you find attachment of a thyroepiglottic ligament, which then joins the thyroid cartilage to the epiglottis, right? Then the arytenoid cartilages, they are paired. You can appreciate them, these two, right? These articulate with the upper border of the cricoid lamina, right? And if you can look at their shape, they are pyramidal, right? And they also have an apex. They have a muscular process and a vocal process, right? So it is an apex. Where you expect to find an apex, you expect to find a base, right? It is 3 surfaces, posterior, medial, and anterolateral, right? Then the process I've shown you, this is vocal, this is muscular process, right? So those are the processes that you expect to find on your arytenoid cartilages, right? 2 in number. Unlike the first 3 that I described, that are only single cartilages. That is the thyroid, the epiglottis, and the cricoid. The smaller ones are going to be paired. That is the arytenoid, the cuneiform, and the corniculate cartilages. In terms of the form of cartilage, remember we said the epiglottis, the cuneiform, and the corniculate, they're actually elastic cartilage, whereas the arytenoid cartilage and the thyroid, as well as the cricoid, being the principal cartilages of the larynx, they are hyaline cartilage, right? So those are the pyramidal arytenoid cartilages that you expect to find in the larynx, and we have identified their processes as having a vocal process and a muscular process, as well as having an apex and a base, right? So on this arytenoid cartilage, the muscular process, if you can look at it from here, it projects laterally and backwards. Then the vocal process is directed forward, right? And these processes are actually parts of the base. Then the corniculate cartilage is not really fancy, but there are those. There are 2. Remember I said they're paired and they're conical in shape, hence corniculate. They articulate with the apex of the arytenoid cartilages, as you can see from this diagram, right? And they lie in the posterior parts of the epiglottic folds that I'm going to describe. Then those are the cuneiform cartilages. They lie posterior or in the posterior parts of that epiglottic folds, just above the corniculate cartilages. You can appreciate their relationship here, right? So the hyaline cartilage, principal cartilages of the larynx, can actually ossify after the 3rd decade of life, and that can be seen on radiographs, right? So in terms of joints, you have the cricothyroid joint between the cricoid and the thyroid. Then you also expect to find the cricoarytenoid. You also expect to find the arytenocorniculate joints. The cricothyroid is a plain synovial joint. The cricoarytenoid is also plain synovial. And the arytenocorniculate joint, not really important, but it's also a synovial joint, but it has no functional significance. And on the cricothyroid joint, you expect to have rotation and gliding movements. The same movements occur at the cricoarytenoid joints, right? Then this skeletal framework, if we can clearly visualize this picture, is interconnected by ligaments and membranes, right? So if you look at the ligaments and those membranes, you divide them into extrinsic and intrinsic. The extrinsic ligaments lie outside of the tube, right? So you have the thyroid membrane and its ligaments, which is this one. It's an extrinsic ligament. Attaches onto the upper border of the thyroid cartilage, right? And it goes to attach onto the upper border of the hyoid bone as well. there's going to be a very important basa known as a subhyoid basa that simply lies between the posterior aspect of this hyoid bone and this thyrohyoid membrane, right? And in its median and lateral parts, it thickens to form ligaments. So you have a lateral thyroid ligament on this side, you have another one on that side. Then in the midline here, you have a median thyroid ligament, right? That's that. Then you also expect to find a cricotracheal ligament, which is this one, right? Connects the cricoid cartilage to the first tracheal ring. You expect a thyroepiglottic ligament. You also expect a hyoepiglottic ligament. And you also expect a cricothyroid ligament, right? Then as for the intrinsic ligaments, you have the quadrangular membrane, which is here, and you have a cricovocal membrane, which is this one, and these two are separated by the sinus of the larynx, somewhere there. So the part of the membrane above the sinus, that's your quadrangular membrane. The part that is below, that's the cricovocal membrane, right? Then you also expect to find a vocal ligament. And of importance, this quadrangular membrane extends from the sides of the epiglottis to the arytenoids, right? Then you also expect to find a vestibular ligament. So that's your vocal ligament. That's your vestibular ligament, right? It's going to attach onto the posterior surface of the lamina of the thyroid cartilage, as we've already alluded to, right? That's your laryngeal cavity. But of importance, let's talk about the muscles first. The muscles can also be grouped into extrinsic and intrinsic. The extrinsic muscles are simply muscles that attach onto the larynx, but they are not muscles of the larynx per se. Palatopharyngeus, which we describe with the pharynx, salpingopharyngeus, stylopharyngeus, which we all describe with the pharynx, then thyrohyoid and stenothyroid, which we were saying they're actually attached onto the thyroid cartilage. So those are simply extrinsic muscles. All those muscles, they elevate the larynx, except the stenothyroid, which is simply going to depress it. Because remember, insertion moves towards origin. Steno, sternum, thyroid, thyroid cartilage. Right. Then as for the intrinsic muscles, which become more important for the purpose of this video, the intrinsic muscles attach the laryngeal cartilages to each other, and those are the muscles that are going to be responsible for the movements of the larynx. So they can either open or close the laryngeal inlet. They can either adduct or abduct the vocal cords. They can either increase or decrease the tension, right? So the muscles that open, or maybe the muscles that okay, the one that opens the inlet, it's your thyroepiglotticus. Then the muscles that close the inlet, you have the oblique arytenoid and the airy epiglotticus, right? Then the muscles that abduct or adduct, you talk about the posterior cricoarytenoid and the lateral ones. The posterior cricoarytenoid muscle abducts the vocal cords, and that is the safety muscle of the larynx because it's actually going to open it. The lateral cricoarytenoids adduct, so do the transverse arytenoid muscles. This is simply an overview for now. But in terms of tension, the cricothyroid tenses the vocal cords, then the thyroarytenoid relaxes them. The vocalis, sometimes referred to as a separate muscle, but it also tenses the vocal cords. And these muscles that I've been mentioning, they're all paired except one. So the transverse arytenoid is not paired. And the cricothyroid will be the only muscle, which is this one, that actually lies on the external surface of the larynx for these intrinsic muscles of the larynx. It's fan-shaped, as you can appreciate. It is a straight part and an oblique part. In terms of innervation, it is innervated by the external laryngeal nerve. Right? That's your cricothyroid muscle. Then the rest of the muscles, I will not bore you with origin and insertion, but you have oblique arytenoid, eriepiglotticus, lateral cricoarytenoid. That one is a triangular muscle. So is the posterior cricoarytenoid. Remember, the posterior one actually abducts the vocal cords. Then the lateral one adducts. Then you have the thyroepiglotticus, just to mention a few. Right. These muscles of the larynx are innervated by the recurrent laryngeal nerve, except the cricothyroid that I've already mentioned as being innervated by the external laryngeal nerve. Right. And if you look at those nerves, damage of the external laryngeal nerve results in weakness in phonation due to loss of the cricothyroid muscles that are supposed to tighten the vocal cords. Then you can have damage of the recurrent laryngeal nerve, especially during thyroidectomy. If you remember what we described when we did the thyroid gland, how you can affect these nerves when you're trying to ligate the inferior thyroid arteries during thyroidectomy. And if you damage them unilaterally, the vocal cord on the affected side comes to lie in a paramedian position, midway between adduction and abduction. However, it won't vibrate. You do affect phonation to some extent, but not that quite, because the other one will compensate. However, if you damage both, that is bilaterally, the recurrent laryngeal nerves, you're going to have both vocal cords assuming a paramedian position, and you have consequent loss of phonation and some difficulties in breathing. Right. Then that's the cavity of the larynx. It extends from a laryngeal inlet where it communicates with the opening of the laryngopharynx. Right. That laryngeal inlet is bounded anteriorly by the epiglottis, posteriorly by an interarytenoid fold, then laterally you expect the epiglottic fold, right? And within this, so that's your laryngeal inlet. And within this laryngeal cavity, there are two pairs of folds. The upper folds are your vestibular folds, which you can appreciate here. Then the lower folds are your vocal folds. The space that is between the vestibular folds is known as the rima vestibuli. The space that is between the vocal folds is known as the rima glottidis. Right. I'm sure at some point you've all watched Miss Doubtfire, which is a popular movie in the early 2000s. And there was something that was used when Miss Doubtfire, the pretending husband, um, got to help a lady who was actually choking, right? They used what is known as the Heimlich maneuver, right? So after if you're going to have laryngeal obstruction, right, maybe due to choking by food, as is the case in laryngeal obstruction or asphyxia, right? The Heimlich maneuver has to be performed or the patient will die. So you're going to stand behind the patient, then you pass your arms under his arms, then you place your hands in the victim's epigastrium, right? And you're actually going to make thrusts so that you protect or you help expel those contents. Right, that's the Heimlich maneuver. You can actually go watch that movie. It's a very interesting movie that is also educative when we come to the larynx, right? Then subdivisions of the laryngeal cavity, you divide it into a vestibule, the supraglottic part. So you're actually dividing it using those folds, right? So you have the vestibule, which extends from the laryngeal inlet to the vestibular folds, right? Then you have a ventricle that is between the two folds. Then you have an infraglottic part. The infraglottic space is labeled on this diagram, which is simply then going to be extending from the vocal folds to the lower border of the cricoid cartilage. And the mucous membrane of the larynx is loosely attached, except over the posterior surface of your epiglottis. And in this laryngeal cavity, you expect ciliated columnar epithelium, except of course on the epiglottis, its anterior and superior surfaces, as well as the epiglottic folds and the vocal folds, which are simply going to be lined by stratified squamous epithelium. Right? And you're going to have glands distributed all over this, this mucous membrane. The nerve supply to the larynx, the sensory innervation, I've already talked about the nerve supply to the muscles. The sensory innervation comes from the internal laryngeal nerve that is above the vocal folds. Below the vocal folds, it's the recurrent laryngeal nerve, right? So that's your inferior vagal ganglion. Don't worry much about that. We'll talk about that in neuroanatomy. That's your superior laryngeal nerve, giving off an internal laryngeal and an external laryngeal, right? So above the vocal cords, the mucous membrane innervated by internal laryngeal. Below the vocal folds, you get the recurrent laryngeal nerve, also coming from the vagus nerve. Then that internal laryngeal nerve, if damaged, there is anesthesia and the supraglottic part of the larynx, resulting in foreign bodies easily entering the larynx without triggering a cough reflex. Then the arterial supply, above the vocal folds, superior laryngeal artery. Where does it come from? Superior thyroid artery. Where does the superior thyroid artery come from? It is the first branch of the external carotid artery emerging on its anterior surface. There. Then you also have an inferior laryngeal artery that is going to give blood supply below the vocal folds. Where does it come from? The inferior thyroid artery. Where does it come from? The thyrocervical trunk. Where is your thyrocervical trunk? The first part of the subclavian artery, if you remember how you divided it using the anterior scalene muscles. Then the venous drainage, it's into the corresponding veins. Then the lymphatic drainage above the vocal cords, you expect the deep cervical group of lymph nodes. Then below the vocal cords, you expect the lower deep cervical lymph nodes. But firstly, they go to the prelaryngeal and the pretrachea lymph nodes. Right. Then you can have different shapes of the rima glottidis. So if you look at in quiet breathing, firstly, this rima glottidis has two parts. The anterior 3/5 are formed by an intermembranous part, whereas the posterior 1/5 is actually formed by an intercartilaginous part. So in quiet breathing, you'd expect the intermembranous part to be triangular, whereas the intercartilaginous part will be rectangular, right? Then in full inspiration, it widens. During whispering, the intermembranous part actually adducts and the intercartilaginous part is separated by a triangular gap. Those are just some fun facts when you want to look at the larynx and how you do voice production. But clinically, there is something known as a vocals nodule or screamer's nodule or a singer's nodule, right? So they're usually bilateral and symmetrical and they vary in size, and you're going to have a soft reddish edematous nodule, right, due to maximum friction. So that's just about it in terms of the anatomy of the larynx. Pleasant viewing.